Hi guys, welcome and welcome back to my channel. If you're new here, I'm Elaina. I'm a Russian American makeup and beauty addict. I love buying and reviewing inexpensive, affordable makeup, and I'll pass the savings to you guys. In this video, this is going to be absolutely different. So if this topic doesn't interest you, then I would advise to click off because there might be some details you don't want to be hearing about. We're going to be talking about some plastic surgery and something a lot of people don't like to talk about, but I'm here and I'll share. It might be helpful for you. So if you want to keep on watching, then keep on watching. Don't forget to subscribe and ring the notification bell. I upload every Monday, Wednesday, and Friday at 11 AM Pacific time. Give this video a thumbs up if it helps you and leave me a comment below. Let's get right into this video. So if you're still here with me after the intro, so I hope you get some valuable information because I figured since I have a bigger platform here, I might as well share with you guys. And some people probably wouldn't feel comfortable sharing, but I kind of like I will share with my friends or with anybody because I find that finding information about this kind of procedures can be difficult, although it's out there online, but it's probably helpful to hear from somebody who just went through it. So I got my breast implants in 2004. Yes, 2004. So the reason you get them, obviously, because you want them. And at the time I was 29 and all my friends in Florida were getting them. It was kind of like a thing. Everybody was getting them at the gym. I'm a fitness instructor. A lot of other girls were going to the same doctor, and I always been thinking about it. I was very uneven. I had uneven size and look. It was kind of a mess, so I kind of needed it. I felt like it would just even out my shape and give me volume. I was an A, the size, and I wanted just to have a C, nothing crazy. So I'm pretty tall, I'm 5'8", so I could kind of carry that size, so my shoulders are not that small. So I went to a good doctor in Florida and I was very happy with him. I got saline, which is safer, under the muscle, which means they cut the muscle to put them in, and it partially hides them so the look is more natural. And you probably heard about it. If you're interested in plastic surgery, you probably know about this. So they're very comfortable and I had no problems with them and I love them. For all this time, it was like 15, almost 16 years, I really enjoyed having them. They were just the right size. They were like a large C, maybe like a small D. On my frame it worked and I liked them. They didn't bother me. I could exercise, I could teach all my classes, all high impact classes, no problems, just a good, sports bra. But in the last few years, it's been a talk about breast implants illness, and usually they talk about, say, not saline but silicone, because silicone can be toxic. So that was a big conversation. But also I heard even saline ones in the future can cause problems, and I kind of feel like I'm kind of over it. I'm 44 now. I'm going to be 45 in April, so we're now in February, so it's like in a month and a half. And I'm thinking, like, what if 15 years later they're old? What if I want them out later? What if I want them replaced? And if I get them replaced, I'm gonna be like 60 something to get them replaced again? No, I don't want to mess with it. I'm like, I think I'm so over it. I just want to be able to teach all my high intensity fitness classes, Zumba, cycle, and feel lighter and not worry about this in the future. Because when you think about this, when you get this procedure done when you're 20s, later on, you probably don't want to have them anymore. I mean, I probably don't want to deal with them later. So 15 years later, I'm not sure what's going on there. Most likely nothing, but I want them out. So first thing, I made some notes. Make sure I don't forget anything. So if you guys are thinking about this, and if you have implants and you're thinking about removal, you have to think about the cost. I was actually shocked. I was naively thinking it's gonna cost the same or maybe less. I was thinking it's gonna cost me less. I'm just laughing because it's so natural. Usually the implants themselves, the full procedure cost, everything included, it's usually around 5,000. That's what we paid in 2004. So we paid with credit card, we paid it off. So it's a debt that you pay off. But to me, like, it was worth it because it evened out my look. At that time, I was so misshapen and uneven naturally. I was just natural and uneven. So it was great. But now I'm like over. So just a month ago, I've been thinking about removing them. And when you get implants, they kind of stretch your skin. I mean, not kind of, they do. They stretch your skin. So if you remove them, what are you gonna have? Bags that's hanging. So some people choose to get them removed but not lifted. But I'm like, I just don't want to deal with the bags. I just want to lift. I want them to look pretty. And the cost is high. It's going to be up to $10,000. I'm just going to tell you straight up. That's how expensive it is. Because the removal itself is probably like around 5,000. And then the lift is like another 5,000. And then there is the operation room cost, might be anesthesiologist cost, uh, the encapsulation, so they remove the capsule, so they clean up the capsules. You get a little bit of discount if you pay yourself, because they offer you payments. So if you pay directly to the office, they charge you some kind of interest. But or I don't know. Well, I got a discount. Long story short, we got discount because we paid with a credit card. And the lucky thing is, my husband, he just got this promotion, and he got a good Christmas bonus. Like it covered the cost. So that's why I went for it. So, and he's so sweet. He's like, and he didn't like the implants that much. You wouldn't believe it, but man, some men don't care about them, I guess. So he was happy, I was happy, but when I wanted them out, he was like, yes, hallelujah. So we decided to go with it. So first things first, so you have to be prepared for the cost. Then I would advise to have multiple consultations, because you don't know what, the feel with a plastic surgeon. You like him. Also, not just the consultation, but also research. Google, research the doctor, the name, the first name, the last name. Have they had lawsuits, their websites, that you can check credentials. Are they board certified, plastic surgeon board certified? Do they have any previous lawsuits? All of this is very important. And when you get discount with plastic surgery, it's not a good thing. I'm a cheapskate, okay? I will not buy expensive makeup. Look at my channel. I buy cheap crap. But when it comes to your body, you can't gamble. So, and I kind of learned it, and I stick to it. Because if somebody offers a discount, there's got to be something wrong with the surgeon, why they cannot get clients. I don't want to gamble with this. So I got two quotes, and one was so much lower. So I called them to cancel the consultation, and they say, oh, we're going to offer you a discount if you come. And I'm like, oh, I don't think so. And then I found some information on that surgeon. Of course, I'm not naming any names, but I found some complaints and really bad reviews. So I'm like, okay, that's why. So I went with, I think I can mention them, because I had such great experience. They didn't tell me I cannot say anything online. I'm pretty sure they're going to be happy I mentioned them. I went with a WAVE Plastic Surgery Center in Los Angeles. And I believe California probably might have higher prices, but I think the pricing is about the same everywhere, just standard for this kind of procedure. So you might get a little less, cost a little less in the mid-country or in a small town, but most likely it's going to be around that number. So I felt very comfortable with my doctor immediately. It was Dr. Ben Lee, and he was wonderful, even consultation. I felt the vibe. Well, of course, I researched him first, okay? I researched everything. None of those doctors said any complaints. I researched their reviews online on multiple websites, their credentials, potential lawsuits, nothing. They're clean. So Okay, so that was good. And I liked him too. He is a younger guy. He has good vibe too. He has good experience. I mean, everything was great in the consultation. So once you find somebody you like, then you want to go for the consultation, decide what you want to do. Okay, do you want to go with the removal and think their skin might shrink? Because if the implants are not that big, you might get a little bit of, skin might shrink. But, when you get to such size from a small size, you might just have some skin hanging. So I wanted a full lift, and I believe they call it a lollipop lift, the one with the, kind of looks like this. This car looks like this. So I guess to get a little graphic here, they remove your areola and replace it up. Everything gets pulled up and the areola gets up. So they even me out so well. I was like, it's like perfect symmetry now. I'm like, yes. Okay, I'm jumping forward now. But let's get back to consultation. So you decide would they want to remove them or you want to lift. So for me, of course, I wanted to lift and we could afford it. So that's what we decided on. So okay, better pay by credit card. If you have low interest credit card, they have money saved. This place gave me a discount because we paid ourselves. So what else? Yeah, the pain. So think about this as being the reverse. So when they cut your muscle to put the implants in, you get the pain from a muscle being cut. So when they take them out, and they just take some pieces of, well, the skin and tissue out because they need to lift. It's not as bad as you might think. I have very high pain tolerance, so don't mind me, but I was thinking it wasn't that bad. So once you decide on a date, you keep in mind, I went for consultation. I scheduled my surgery for the next week because I had some events, my job was coming up, and a fitness instructor, and I knew I'll need weeks before I can work out. So I'm like, this is the right time before my job starts. So remove your nails. I paid for it. I don't know how I forgot about this because it was such a long time ago. I had first procedure. So I went for consultation and I just had my acrylics done. Just had them done. Darn it. And they're like, you can't have acrylics because they have to look at your nails during surgery. So I still have not put them back on. I just kind of didn't feel like it. And I'm like, well, I just want to do this before the vacation. So long story short, keep that in mind. The nails will have to go. So what else? Yeah, if you're taking vitamins, any blood thinners or vitamin fish oils, any vitamin supplements that might thin your blood, I would stop everything. Probably like a week or two before the surgery. I stopped 2 weeks before the surgery. And they also, although this is not medication, but it's a natural remedy. It's arnica. Arnica helps with the bruising and swelling, so it's recommended to start taking arnica before the surgery. So I started taking like 4 days before the surgery, and then after a few days after, I took like a week after, just to make sure. So what I'm getting through here. Yes, so before they're probably gonna measure you and fit you for the surgical bra. It's the same thing as with breast implants. You'll need a bra, but usually those bras are not that comfortable. So you need compression and you need to keep them up, and pressed in. So I would say any sports bra. I got sports bra on Amazon that was better than surgical bra, and I'm glad I got it. So I ordered that and I used that instead. I used two of them, one on top of the other. So why it's important to compress? It's even more important to compress. You don't even think about it, right? But it's important because they taken the tissue out, and because they taking something out instead of putting in, you accumulate fluid there because there is empty space. So the fluid, it's not like something crazy or like infected. No, It's just natural fluid. Your body produces that fluid. It's serous fluid. So it's gonna fill in if you don't compress. So it's just the truth. It does happen. So the probably either gonna put the drains in you or not. If you watch all this botch shows, you've seen that people put drains, so the fluid drains, so it's gonna be like a week. But nobody likes that. So all the modern doctors, I would say, like nowadays, nobody wants drains. So you just wear compression, and they're gonna, well, you might not like this idea, but they're gonna use the needle and a syringe, and a few days after the surgery, gonna pull it out. It's completely painless. It's like Dr. Pimple Popper, if you ever see her pulling out seroma. I mean, not seroma, the cysts. It's the same thing. They numb you and pull it out, nothing, no pain. So this is like the last thing you need to worry about. So again, when you go for consultation, I would advise, I mean, it's just my experience from what I think. I wanted to keep some of the size. So I was asking him, so what am I going to be? Am I going to be back to A, like a real small A, or is it possible to maintain a B? And he says most likely it's going to be A if they remove the capsule. So the capsule, it's a scar tissue that accumulates around your implant, and there's nothing wrong with it, so they can keep it, and it's going to give you a little volume. So I'm glad I opted for that, because I kind of have a nice size. I still have a B, like a good B now, so I'm not mad at that. So I'm glad I went for this, and a lot of doctors recommend keeping the capsule, because when you remove it, you remove a lot of other tissue. It's hard just to remove the capsule, so it's less invasive if they keep the capsule. So that's what I learned. Again, I'm not a plastic surgeon, I'm just saying what my experience is. So capsule in, the size was good. So for the day before surgery, you can't eat anything. Of course, they're gonna tell you all that, but I'm just saying, just make sure you don't drink anything or eat anything, because nobody wants you to throw up when you're out. Another thing that surprised me, that might help you if you're going through this procedure and you don't want to be surprised and concerned. I don't think I had this experience before. When they intubate you during surgery, anesthesia, and the tube goes down the throat. And because it goes like sideways or something, it can scratch your throat. So when I woke up the next day, I had sore throat. So I'm like, where did they give me a virus? Now I have a cold. So I was so freaking out that they gave me some kind of disease, and now I have a cold, and now I have sore throat. I'm like, what the heck is going on? But I researched it, I googled it, and that's what it is. The tube scratched. But this here, I didn't know. So now you know because of me. So if your throat scratches, it's a small thing, but it's like something like after the surgery you can be like freaking out, small things like what is going on, and it's nothing. So the surgery takes a few hours. Let me see, they said they booked 4 hours for my surgery, but I think it was more like a 2.5. It's not that complicated. What else? I woke up, I didn't throw up or anything. They give you anti-nausea medication, they give you painkillers, and they give you antibiotics. So you take antibiotics the next day, and the painkillers, they give you the strong ones. And you're probably gonna be shocked, I did not take one. Not one. I didn't even take Tylenol. I didn't take ibuprofen. That's how good the pain was. I mean, there was like nothing. It's just literally just a little discomfort, like it's there, the stitches, but it's like nothing major. And when you walk and move, you kind of feel little pangs of pain, but nothing that I thought it would be worth taking medication for. So it just might be just me, but it was the same thing for the breast implants. I never took any medication for them. So just take it with a grain of salt, because we're all different. I'm just like freakishly have high pain tolerance. So what else in my notes? Yeah, so they tell you no exercise for 3-4 weeks. usually say 4. As a fitness instructor, that was the worst. I'm like, I can't go without exercise a day. So I was like freaking out. So my doctor knew it and he said, well, you can go for a walk. And if you want to go for a vigorous walk. So I went hiking to Griffith Park. And if you know, Griffith Park is where the Hollywood sign is. It's really high. So you can hike up the mountain, literally like up. So your heart rate goes up. And you're not supposed to raise your heart rate because it creates bleeding, it can create problems. So thinking back, I'm probably lucky I didn't get any complications because I went to town. I couldn't exercise, but hiking is walking in my world. He said you can go for a vigorous walk, so I went up the mountain with my husband and dragged him. So that was okay, I guess, but I did accumulate fluid and I saw it was kind of like they're swelling. So they did that. So like about a week after, it was like 3 days after the surgery, I think, for the follow-up, they numbed me, they took a syringe, and pulled out a lot of liquid, that's fluids. So it's called seroma, but it's nothing dangerous. So if you're listening to this and freaking out, there's nothing wrong with seroma. It's very natural. It also accumulates. And if you don't have drains, they just pull it out with the syringe. And that was painless. Actually, it was a relief because, you feel like, oh, such a relief. It's out. So that happened twice. On one side once, on the other side it was twice. But that was like 3 weeks later. Now I'm 5 weeks post-op, 5.5. So I decided to wait making this video until I know what the recovery is like. And I would say for me it was easier in pain-wise than the breast implants, but it was harder because I accumulate all the fluid. With the breast implants, you don't get the fluid. When they take some it out, the tissue out, you accumulate the fluid. So that was like the worst part because I couldn't move, I couldn't exercise for 4 weeks. And now I'm back to teaching Zumba, I'm back to teaching cycling, no fluid accumulation, I can bounce. I just wear 2 bras. And if you want to see, that's what it looks like now. I mean, it's just a B. If you want to, I'm probably gonna find a picture where you'll see me, size-wise of what it was like before the surgery. And with the implants. But I'm very happy with this, They're just right size. He did a wonderful job. They're very symmetrical. Everything where it's supposed to be. All the parts were supposed to be. So this is a very good experience. So I would highly, highly recommend Wave. And no, they're not paying me for this. I'm just sharing it with you guys. They don't even know I'm making this video, and I hope I don't get in trouble. But Dr. Ben Lee, he rocks. I really like him, and he's cool and he's funny. I told him he needs to go on TV and make himself a TLC show like Botched. Botched is on E, I think. Well, anyway, he needs a TV show. He's cool and he's smart and he's funny. So that's my 2 cents about wave surgery. So I think I covered everything. Let me see it, my phone. Yes. Oh yeah, when you are out, like 2 days, 3 days out, you probably after 3 days, you can start sleeping on the side slightly, but they recommend you sleep on the back like the first few days and elevate it because of the fluid, You want to keep your head elevated, maybe put like 2 pillows so you're a little elevated and try not to sleep on the side. So that's the only thing was uncomfortable because you have to be like upright. Look, not upright, elevated and up on your back. So I hated that. But a few days later, it can kind of scoot over a little bit on the side. So let's see. In arnica, I still take 2 arnica. I think it does help because it barely had any bruising. You should have seen me. It's like literally almost no bruising. So it probably does help. Of course, good nutrition, good diet helps. You want to eat healthy overall. As a fitness professional, I could not recommend you more to eat fresh food, fruits and vegetables, everything pretty much common sense. And before the surgery and after, it's very important to receive enough protein for tissue build, and especially for breast implants because muscles healing, so protein is important. But for any, you want to have good nutrition and good sports bras. A few weeks later, you should be able to wear normal bra. So now I'm wearing like a normal bra, not a sports bra, and I should be able to wear underwire in a couple more weeks. So I think I covered everything. So if it's TMI, I'm sorry. But I hope this helps somebody, because as a patient myself, I would be researching this and seeing what other people's opinions are. You can ask the doctor because obviously that's your best source. I'm not a doctor, but I am a person that just went through it, so it might help you. So I hope you found this video helpful, and subscribe to my channel if you haven't yet. I pretty much just talk about makeup, no graphic plastic surgery stuff. So I upload every Monday, Wednesday, and Friday at 11 a.m. Pacific time. Give this video a thumbs up if you find it helpful, if you enjoy it, and leave me a comment below. Do you have any plastic surgery experiences? I find it very fascinating. I think plastic surgery is really cool if it fixes something that's important and can be fixed, or for whatever reason. We're not here to judge anybody, right? So I'll see you guys in my next video, and thank you for watching. Love you. Bye.